Well, the New South Wales health crisis, as we've been discussing, is worsening, and the state's paramedics have escalated their industrial action ahead of voting day on Saturday. They say they're sick and tired of being ignored. Well, joining me now is ABA New South Wales, that's the Ambulance Association New South Wales delegate, and paramedic Brett Simpson. Brett, thanks for joining me. As a paramedic, how heartbreaking is it to turn up too late to someone's home when their medical condition has deteriorated to the point where they're fighting for their life?
Yeah, look, it's really heartbreaking, and it can be incredibly distressing, not only for the patient and their family members, but it does take a toll on paramedics as well. I've been a paramedic for 14 years, and I can tell you I've been in this situation countless times over that time period. I guess what it means for us is sometimes patients are sicker, and then, when they're not getting that treatment on time, it can mean their hospital visits and admissions are longer and more complex and ultimately more costly for the health system.
Look, what in your view is the actual issue here? Is it that there's not enough paramedics? Is it that there aren't enough physical ambulances? Or is it that the patients aren't being admitted fast enough at hospitals, and so, there's a backlog of ambulances there that can't get to more urgent cases?
Look, unfortunately, it's not just one issue. I wish it was just one issue. It would be much simpler to fix. What we're seeing is a multitude of factors in New South Wales. We're seeing a lack of paramedics and vehicles, like you said. We've got some of the lowest paramedic to population ratios in the country. But specifically a lot in regional areas of New South Wales, they don't have a lot of access to a lot of specialist paramedics like we do in metropolitan Sydney, Wollongong and Newcastle. So in regional New South Wales, having some of those extra resources are really important. Some of those paramedics spend a very long time specialising in skills that means that patients can stay at home. Our extended care paramedics can perform some very complex procedures to prevent people having to go to emergency in the first place. I guess the other thing that we're really fighting a lot at the moment is our pay and remuneration. I mean, New South Wales paramedics are the lowest paid paramedic workforce in the country with some of the highest costs of living. So unfortunately, whilst we're very pleased to see some massive recruitment happening in New South Wales, a lot of those staff are in fact fleeing to other states where pay and condition can be up to $20,000 or $30,000 in some cases.
Yeah. Look, Brett, I'm very sympathetic on this issue, as you probably know, but isn't this a reckless union stunt that we've seen this week where the union's deciding to effectively dump patients at hospitals? The fact that it's in the week of a state election. I mean, I get how important the issue is. You don't need to tell me about that. I know firsthand how important it is. But isn't this a political stunt?
Look, I can't speak to the Health Services Union's industrial action that they've organised for their members to undertake, but all of the industrial actions that the Australian Paramedics Association undertake are always aimed at disrupting the ambulance service and the government, whether it be through our billing bans or refusing to move out from our home locations to fill roster gaps. We'll always make sure that whatever industrial action we're taking is always going to ensure that the patient remains at the focus of everything we do. So that's what our intentions with our industrial actions have been and will continue to be going forward.
But the timing of it this week, I understand you don't make those decisions, but that is very political, a few days out from the election campaign.
Yeah, of course. And
from voting day, not the campaign.
Yeah, of course. I guess the frustration for paramedics right across New South Wales is that we're not being listened to, though. So we're really left with very few options other than to escalate and make sure that the ambulance service and the plight of paramedics are forefront in voters' minds when they head into the voting booth on Saturday. We've seen a number of ambulance stations announced by the Liberal National Party, but again, they're pipe dream ambulance stations, effectively just written down on paper. We've seen some movement from the Labor Party in so far as scrapping the wage cap, but again, that still leaves us with productivity-related pay increase limitations.
Okay.
So it is very frustrating.
Okay. I understand. Brett, last night I had the Premier on my program and he admitted, partly last night and then in a more detailed press conference this morning, he admitted to calling the Health Minister for an ambulance when his wife needed one, and that it was actually the Ambulance Commissioner, Dominic Morgan himself, who called the ambulance. The point is not that he used his contacts, it's that he was able to effectively skip the queue, whereas everyone else has to wait quite a long time, as we've been discussing, for an ambulance. You know, what are your thoughts about this?
Look, I guess, it sounds like the Perrottet family had a very distressing situation, and they're now, unfortunately, counted amongst the statistics of every other person in New South Wales that appears to have had some sort of delayed response. I believe in media reports today that 40 minutes was the time frame given for Mrs. Perrottet to receive her ambulance. And when someone is highly distressed and in excruciating pain, that's really unacceptable. So really it brings us back to these are the reasons why we're pushing so hard to ensure that the ambulance service is well staffed, well equipped, well trained.
But as a paramedic, do you think it's unfair that an ambulance might have been diverted from another case, or would have been diverted from another case, to attend to this fitness injury?
Look, we don't know the exact details of this case yet. The union hasn't had our questions, responses to our questions provided to us at this stage. So, until we get that information, it's hard to get all the circumstances around it. But, the rest of the New South Wales public doesn't generally have that level of reach into the health system. So what we're really fighting for and what we're trying to get are some answers, but making sure that the ambulance service is fit and proper for everyone right across New South Wales, whether you're in, Broken Hill or Bondi. It has to be the same for everybody.